provide more of a snapshot to what I've seen at Fort Benning over the last 2 years, specifically off-post installation. My family meets that criteria because my wife said we're moving to the schools, and so we live really far away. Sergeant Major Pat Hartung, ARTB Sergeant Major, by the way. But what I've seen over the last 2 years is exactly that, and so it may be partly a problem of bringing private practice individuals into the TRICARE network, but the bigger, more concerning thing that I've seen from both my soldiers and personally for my kids and my spouse is we've got providers who are leaving the network and starting to refuse to provide support. Most recently on the dental aspect, Humana, we have had actually really good dentist, former military himself, and he stretched it out for about 18 months with the families that I know that send their children there, to the point to where he could no longer financially make it work for his practice. And so, I mean, some people are choosing to essentially pay to keep the care that they were getting. And I don't know exactly what it was, but like I said, my snapshot has been over the last 24 months is when it kind of started, and we've seen more and more fall off the network. Just to take that back to DHA, I guess, because I know it's not much a question for you, ma'am.
So, Sergeant Major, if you could share your information with Major Lee right there, if you're willing to share your story. This is George's and my personal battle, because I think it's the other area right after one of the other topics that hasn't come up yet, but I'm sure will, that we hear every time we go to PCC. And I am with you. We've got to, if we're saying we're going to provide a service, we have to provide a service. We can't quietly not do it and have that be a way that we save money.
I just want to piggyback real quick on that. It seems to be specifically specialty providers that we're running into. I have to pay out of pocket for an endocrinologist. There's only one in the Savannah area, I believe, that accepts TRICARE. My neurologist stopped accepting TRICARE and actually told me when I took my son in and read me the riot act to the point that I'm going to pick up the state healthcare because we have a shortage and we're just not getting it. And while he's accepting it, it's about the money that TRICARE is paying providers, and that's why we're seeing them drop off left and right.
Right.
So it's a real big issue here in our southern states, especially when we talk about the education opportunities available for medical school and those pieces. It's all coming to a head, and military families are taking it on the chin.
I very much appreciate your sharing that as well. So I was just looking to see if my name was up there. So if you have a personal story that you'd like to share that I can carry back to help paint a picture, because I do believe there's people working very hard in the Pentagon that want to do better and want to do exactly what we're talking about, and stories motivate. So I am Mary.K as in kilo.isagetti.mil@army.mil, and then we can help leverage your stories to help make it better to where we need to be, because I'm convinced we can do that. We can do that, and we need to do that.